Hi everyone. In this video, we're going to cover all the most important things that you need to know about the medicine Brexpiprazole, also known as Rexulti. We're going to cover side effects, who can't take the medicine, how it works, what it's used for, dosing, how long it takes to start working, what to monitor while taking it, and some special considerations that I think are important to know. My name is Mattias Hartmann. I'm a physician associate, board certified in psychiatry, and I work full-time in psychiatry. I make these videos for people like yourself who want to better understand depression treatments, and medications. Let's get started first with Brexpiprazole, also known as Rexulti's most common side effects. Increased triglycerides at 8 to 28%, which is something that one notices on blood work. Increase in weight gain can happen in 2 to 11% of people, and the increase in weight gain that happens in 2 to 11% is greater than 7% of the person's body weight. So if the person gains more than 7% of their previous body weight, then that's what they're talking about there. So anything less than that wasn't really recorded there, but weight gain is a common side effect. Severe restlessness, this is also known as akathisia. This can happen in 1 to 14% of people. And of course, tardive dyskinesia. So any medicine that blocks dopamine. Other ones that are similar to Rexulti would be Abilify, also known as aripiprazole, or Vraylar, also known as cariprazine. There's many others as well, but they can all cause tardive dyskinesia. I have a whole video on tardive dyskinesia, so if you are curious about this, want to go a lot more in depth, be sure to check out that video on the channel. But tardive dyskinesia can happen. It's unclear how often or how much it happens, but happens about 4.2% yearly risk. At the 10-year mark, there's about a 42% risk of developing tardive dyskinesia, which is a potentially permanent abnormal movement disorder. And Rexulti is in the intermediate risk category. Some of the medicines are low risk, some are high risk. It's right there in the middle. Some of the less common side effects of Rexulti are headaches at 9%, feeling tired or fatigue at 3 to 5%, dizziness at 2 to 5%, reflux or GERD at 3 to 6%, tremor at 2 to 5%, anxiety 2 to 4%, and constipation at 2 to 3% of people. Next, let's go over some of the rare but dangerous side effects of Rexulti. Neuroleptic malignant syndrome can happen. This is where dopamine gets blocked too aggressively, too rapidly. It usually happens early on when starting the medicine, or if there's some medicine change that happens that blocks dopamine really aggressively. Some of the signs and symptoms of neuroleptic malignant syndrome include confusion, fever, muscle rigidity. Seizures can happen. Suicidal thoughts. This is with any psychiatric medicine. It's rare, happens in about 1% of people, and it mainly happens in people under 25 years old, so younger people. Impulse control problems can happen, and increased risk of death and stroke in people with dementia. This is, as a class, most of the medicines that block dopamine have this warning on them. So not just this medicine, really every one of these in the same class. So what are the contraindications to Rexulti? Who can't take it? Well, if you have an allergy to Rexulti, you shouldn't take it, and that's it. How does Rexulti work for depression? Well, it has a complex mechanism, as most of the medicines do in this whole category of D2, also known as dopamine 2 blocking category, but that's part of the mechanism here. It partially is a partial agonist or activator of dopamine 2, so D2, that dopamine 2 receptor, and it works as a 5-HT1A agonist or activator. 5-HT just means serotonin. 1A is a specific receptor on serotonin, so serotonin 1A activator. It also blocks 5-HT or serotonin 2A. It has many other mechanisms as well. Those are the three main ones that are thought to be why it works for what it works for depression or anxiety conditions or psychosis conditions, but it has some other mechanisms as well. It blocks alpha 1B and 2C receptors. It blocks 5-HT7, and it is a partial agonist at D3, which is a different dopamine receptor. So what is Rexulti used for? Well, let's go over the FDA indications and FDA approvals. So it's used for schizophrenia in people ages 13 and up, but that's not all. It's also used for major depressive disorder, which is what this channel is about, but only as an adjunct. So what an adjunct means is you have a base medicine that is known to work for depression by itself. Let's say Prozac, for example, also known as fluoxetine. And you give that medicine because it's known to work for depression just by itself. It doesn't need anything else. And a lot of people, they don't get better all the way. They get partial response. So they still have maybe 50% of depression symptoms left or 25% of depression symptoms left. So in those people, what's usually recommended is not to switch the medicine from Prozac to something else. What's usually recommended is to add an augmenter or an adjunct. And so that's where Rexulti comes in. You can add Rexulti on top of, for example, we were using the example of Prozac. You can add Rexulti on top of that medicine for major depressive disorder, also known as unipolar depression, also known as just depression. The other FDA approval is agitation in Alzheimer's disease, but it's also used off-label for many other things: bipolar disorder, PTSD, impulse control issues. So what is the dosing for Rexulti in depression, also known as MDD, also known as major depressive disorder? And remember, this is as an adjunct, so you're adding it on top of a different medicine. You start at 0.5 milligrams to 1 milligram daily. The usual range is 2 milligrams. That's where most people need to be, it seems, with Rexulti, and the max dose is 3 milligrams total daily. So how long does Rexulti take to start working for depression? 2 to 4 weeks is what it seems, and that's pretty typical with most medicines. So is there anything that needs to be measured while taking Rexulti or monitored? And yes, so you want to get blood work. You want to measure a hemoglobin A1C, which looks at your blood glucose level average over a 3-month time span. So we're looking for things like diabetes. You want to get a complete blood count at baseline, and you want to get a lipid panel as well. You always want to monitor for tardive dyskinesia. How often depends on the medicine you're taking. So Rexulti is in the intermediate risk category. And then, of course, if there are any other risk factors that make you more likely to develop tardive dyskinesia, and the dose also depends as well. If you're on a lot higher dose, there's a higher risk. If you're curious about tardive dyskinesia, I made a whole video about the risk of tardive dyskinesia, so be sure to check out that video on the channel. And of course, you also want to measure height and weight. You want to monitor BMI and weight because weight gain can happen with Rexulti. Lastly, let's go over the special indications for Rexulti. It might be helpful in combination with sertraline for PTSD. It might be especially helpful for that. It, of course, can cause tardive dyskinesia. It's in the intermediate risk category. This is always something you should consider because it's a potentially permanent abnormal movement. So you got to weigh the risks versus the benefits and weigh that ratio there and make sure the benefits outweigh the risks. And it's very similar in its mechanism to Abilify and Vraylar, because both of those also are partial agonists at the D2 receptor. So since Rexulti is a newer medicine, it might be too expensive. If it's something that can't be used, you might want to consider the other medicine that's been around for a lot longer called Abilify. It works very similarly, can also be used as an adjunct, meaning in addition to an antidepressant for partial response. If you like this video, be sure to check out this video on screen on Abilify, also known as Brexpiprazole. It works very similarly, has a very similar mechanism to Rexulti, and it's also used as an adjunct for major depressive disorder. I go over all the most important things you need to know in the video on screen. I'll see you over there.